Addiction impacts Alaskans in every community, and recovery is possible. The Pathways to Recovery Conference brings together experts, advocates, and community leaders to share solutions and strengthen support systems.
So my name is Adam Gordon. I'm an addiction medicine, internal medicine physician. I'm a professor of medicine and psychiatry at the University of Utah. I'm also director of the Program for Addiction Research, Clinical Care, Knowledge, and Advocacy, or PARCA. We do a lot of research with regards to improving access and quality of care for patients with addiction. Alaska is a forefront to a lot of things, how to provide telehealth or how to provide remote care of all types of health care diseases. And I think Alaska can be a forefront of this process for addiction care and changing the healthcare system so that addiction care can be done well in rural areas or in regional areas where there may be indigenous populations, Native Americans, and how to do culturally adaptive care so that Western medicine can actually merge and help with kind of the traditional tribal systems of care. And I think there's a lot of opportunities that Alaska has in order to lead the country in that area. And stigma is a big problem in our field. We don't usually have stigma associated with diabetes care or cancer care, but stigma is a very prominent problem in our addiction world for a variety of reasons. Number one, there may be a provider may have stigma, negative stigma toward a patient, or maybe the diagnosis, or maybe even the treatment. But likewise, there may be stigma of the patient toward the provider. They may have not had good experience with healthcare providers in the past or treatment programs in the past. They may have get kicked out of care. So we have to overcome that stigma, both on the provider level, but also the patient level. One of the things that's been remarkable in the last 6 or 7 years is how we talk about this disease. We used to call people users or addicts or abusers. So far today and throughout the conference, I don't see any of those stigmatizing languages, which is a great monumental leap in how we address populations and how we address recovery as well as treatment.